Hello everyone, I am Dr. Himanshu Dhawan and today we are going to discuss varicocele and what it is, why it tends to affect leaner individual more frequently, and most importantly, what you can do to prevent or manage it. Varicocele is a condition that involves swollen veins in the scrotum, which is the pouch that holds the testicles. This happens when blood doesn't flow properly and instead flow backward towards the testicles, causing the veins to enlarge. And it can lead to pain, discomfort, or a sense of heaviness in the scrotal area. To help you visualize what's happening, think of the pipe that has a blockage, causing a pressure to build up in a certain areas. When there is too much pressure, that part of the pipe bulge out, and similarly with varicocele. When blood pools and doesn't flow out efficiently, the veins expand, become swollen. This process can gradually lead to noticeable enlargement, visible veins, and discomfort in the testicular region. Now you might wonder why this condition seems to affect leaner individuals more. There are a few reasons for this, one of which is abdominal pressure caused by factors like constipation. Constipation is a more than just a digestive issue. It can add serious pressure on the lower abdomen, which pushes down on veins that lead to the scrotum over the time, and this added pressure can increase the risk of developing varicocele. So if you often experiencing constipation, taking steps to manage it essentially. Start by increasing your fiber intake with foods like fruits, vegetables, and whole grain, which can help keep your digestion regular. Staying hydrated is also important. Adequate water intake helps prevent constipation and keeps everything moving smoothly in the digestive tract. Another factor that can contribute to varicocele in a lean individual is physical activity, specifically weightlifting. When we lift heavy weights, we naturally tense up the abdominal muscles, increasing intra-abdominal pressure for lean people who may be lifting to gain muscles. This pressure on the abdominal veins can increase the strain on the veins around the testicles. This doesn't mean you need to avoid strength training altogether. However, when lifting heavy weights, especially if you are just starting or lifting above your normal limits, it's essential to wear a supporter or protective gears. A supporter provides compression and helps minimize the strain on the lower abdominal area. Also, practice correct breathing techniques while lifting, exhaling as you lift, reduce pressure in the abdominal and minimize stress on the veins. Another factor, especially common in regions where motorbikes or scooters are frequently used, is the impact of regular riding. Frequent riding of two-wheelers, particularly in warm weather, can add to the strain on the scrotal area. When it's warm, the scrotum naturally hangs lower to regulate the temperature, which places more pressure on the veins. Extended rides, especially on bumpy roads, can further increase the risk. If you regularly use a two-wheeler, make sure your seat is comfortable and, if possible, avoid sitting for long stretch without breaks. A few short breaks on longer rides can help relieve pressure and allow blood flow to normalize it. If you are already experiencing some early symptoms of varicocele, such as a feeling of heaviness, mild discomfort, or even noticing that the veins in the scrotum appear more prominent, there are steps you can take to help manage the conditions. Don't ignore these early signs, as early management can often prevent symptoms from the worsening. First, pay attention to activities that might be increasing abdominal pressure. Consider modifying any exercise routines that involves heavy lifting and focus instead on lower impact exercises that doesn't strain the abdominal area. Light cardiovascular exercise like walking, swimming, or cycling or a smooth path can actually improve circulation without putting undue pressure on the veins. Managing stress is also essential for circulation and overall health. High stress can cause muscle tension and impact blood flow. which may worsen varicocele symptoms. Engaging in relaxation practices like deep breathing, meditation, or even gentle yoga can be highly beneficial in reducing both physical and mental stress, which indirectly supports better blood circulation. If you are wondering what could happen if varicocele is left untreated, it's important to note that complications can arise. One of the main concerns with untreated varicocele is its impact on fertility. Varicose is one of the more common cause of male infertility because enlarged veins can raise the temperature around the testicles, affecting sperm production. If sperm quality and quantity or a motility is affected, it could make a conception more challenging for couples trying to conceive. Another risk of leaving varicocele untreated is testicular atrophy, where the affected testicle may shrink in size. For these reasons, it's best to consult a good physician if you experiencing any symptom, particularly if you are planning to have a children in the future. If you are already dealing with varicocele and looking for a ways to relieve symptoms, there are some helpful options. Wearing supportive underwear can provide comfort and reducing movements, which can elevate some of the discomfort. So if you are lean and want to reduce your risk of developing varicocele, make a few lifestyle adjustments. Prioritize a high fiber diet to prevent constipation. Wear proper supporter when lifting weights and avoid extended riding on two-wheelers. Especially in the hot weather, if you are noticing early symptoms, make a few modifications to reduce pressure. Stay active with circulation friendly activities. Try to include Kegel exercise in your daily routine and manage stress to support better blood flow. If you found this video helpful, please like, share and subscribe to our channel. If you have any question or need further advice, feel free to reach out to my team. We are here to help you. Until next time, take care and stay healthy. Goodbye.